Hi, today I wanted to talk to you about GE bone density, unraveling the GE bone density options from the GE Lunar DPX IQ to the GE Lunar Prodigy. First, we're going to start with the GE Lunar DPX IQ. These systems were manufactured from the early 90s up to about 1999-2000. The systems were pencil beam, which is a slower scan technology. They were very limited in features, considered a workhorse, again, entry level, focused on AP spine and femur only. There were some systems with total body features available, only on the 8-foot tables though. And these came in a 6-foot compact as well as 8-foot. The limitation of the DPX IQ in today's market is the fact that it only runs on Windows 98. Now, Windows 98 is definitely an issue, considering that there's very few options available for computers in today's marketplace. Building computers for Windows 98 is not that easy, which then puts a limitation on what you can or cannot do with the DPX IQ. In addition to that, the DPX IQ inventory is beginning to dry up very quickly. So we can move on to the GE Lunar DPX NT. The DPX NT was originally based on the Windows NT platform, which was pre-Windows XP. These systems are capable of running on Windows XP. They can also use the newer Encore software. They do come as a 6-foot compact and 8-foot options. Like the DPX IQ, they were limited in features, offering, again, based on pencil beam technology, offering AP spine and femur. And with the Windows XP, they would also do DICOM. Moving into the newer platforms, the GE Lunar DPX Bravo. There's a DPX Bravo and a DPX Duo, which we'll review in a minute. These systems also based on pencil beam technology. Again, the main feature being the AP spine, the dual femur, DICOM, since it can run on Windows XP. It can use the newer Encore software. This is only available as a compact. What's unique about the DPX Bravo is that the arm on top will actually swivel and move out of the way, which frees up table space. All standard bone density arms are in a fixed position, although they can rest either at the foot or the head of the table. The DPX Bravo and Duo will actually have a moving head. These are also smaller. They're easier to ship as a compact unit, pre-calibrated with an arm on the unit, which you can contact us about and we can discuss further. Moving from the DPX Bravo, we'll see the DPX Duo. The DPX Duo is different than the DPX Bravo in that it doubles as an exam table. Over here, in this area here, you can see stirrups, similar to an OBGYN table. Down in this area are actual drawers, as well as a step. You can see it's a compact table. It only is available in a 6-foot. This arm also swivels out of the way to free up space when a patient is lying on the table. Based on pencil beam technology, also limited in features with the AP spine, dual femur, seeing that it can run on Windows XP, can also use the newer Encore software. We can also feature systems with DICOM with nice connectivity to EMR. Moving on from the DPX Duo, we'll actually move into the newer line of the GE systems, which is the GE Lunar Prodigy arm. LVA, which is one of the bigger advancements that came out in later years, but is now available to be put onto the legacy systems. The LVA is the fracture risk assessment component, which is very important in bone density testing. Total body scan, which is the head to toe body scan, as well as the body composition analysis, which compares the lean mass to the fat mass. The systems are running on Windows XP with an Encore of 12.3 at the highest, offering DICOM capability. These are available only in an 8-foot, again featuring the total body. Moving from the legacy in 2001, there were some minor modifications made to the internal components, and also some changes cosmetically to the external. The features were more or less the same. Today we're able to put the Encore 14.1 software These will also run Windows XP and Windows 7. The biggest change on these systems, there are some other features, but in terms of main features would be FRAX. The FRAX is a very important indicator, also a fracture risk assessment, similar to the LVA as a fracture risk assessment, but it just gives a numerical representation, and it gives a 10-year predictor based on the T-score and Z-score of the person, whereas the LVA is an actual scan that gives the 5-year fracture risk assessment, the LVA being a very important feature on the systems. The next system I want to talk about is the new Prodigy, the brand new GE Lunar Prodigy series, whether it's the Prodigy Primo or the Prodigy Advanced. Visually the same with the same fan beam technology. Main advancements in technology in terms of features, the difference between the P3 and above and the new Prodigy. The new Prodigy's giving some features like advanced body composition and others, but the big change also with the Encore 15.1, we can get more in depth in direct conversation. So if there's any other questions that you have specifically about some of the other features, you can contact me directly. But most importantly, I wanted to point out the main features that one would be looking at when they're doing bone density. And this advanced body composition is definitely a big step up from standard body composition, allowing some features that are not available on previous systems. This also being available in 8-foot and 6-foot compact models running Windows 7. So that's it for today, talking about the GE lineup of bone density. If you have any other questions, my name is Jeff Rubinoff, Vice President of Complete Medical Services, and I'll look forward to taking your emails or phone calls. Thank you very much.